Hello, everyone. I'm Jim Garrison, and I want to welcome you to day 90 of Humanity Rising. Starting back on the 22nd of May, Ubiquity University and upwards of 400 partnering organizations from all over the world have come together to offer a daily session between 5 and 6:30 p.m. Central European Time, Monday through Friday, as an opportunity for people from all over to come together and share their experiences of the pandemic, to share solutions that they're implementing in various areas of human concern, to confer on how we increase our strategic effectiveness so that people of goodwill worldwide can ensure that the post-pandemic world is more sustainable and resilient and healthy and abundant and in alignment with natural systems and constraints. We've talked about just about everything in the last 90 days, from economics to politics to science to culture to art to spirituality. Perhaps the most consistent theme that has emerged has been the need for coherence. And I think it's worth just pausing for just a minute to underscore this fact. The pandemic stopped our world literally in our tracks, put everybody in some form of lockdown, forced us into social distancing and wearing masks. And quite literally, for the last 6 months, fear has gripped our world. As people don't understand really what's happening, they just know that their future is now in doubt. And so the pandemic, in addition to a virus challenging us with a phenomenon in our physical bodies, COVID-19, has also had a remarkably debilitating effect on our psyches, on our hearts, on our souls. And that is why time after time, people have been talking about the importance of compassion, community, coherence, love, intimacy, because that's what it's going to take in our interior to give us the internal equilibrium to navigate through a world that is only going to escalate in the intensity of the extreme weather events, like what's hitting California, with a combination of COVID, fire, and now record-setting heat. And other places all over the world are experiencing this interface of extreme weather and a pandemic that just won't go away. So a central question is, how do we engage in the practice of heart coherence? We started on May 22nd, the very first thing we did after calling the blessings of the ancestors with an indigenous elder from the Iroquois Nation. We had a heart coherence meditation. And as we started back up in September, we decided that we would start each of our sessions with a heart coherence, a minute of heart coherence. In my mind, I don't think there's a more important thing that any of us can do than practice heart coherence. It's key to any successful navigation through what we're all experiencing. So I'd like, before turning it over to Jan Bonhoeffer, who's a professor of pediatrics at the Children's Hospital at the University of Basel, engaged in a lot of medical and scientific affairs, who is bringing together the panel today to really talk about heart-based medicine within the context of how medicine needs to evolve under current world circumstances and also current world possibilities of what we know about what constitutes a strong immune system, its coherence, what allows us to heal is coherence. And so this whole session is going to be on how the medical profession engages in its own future development, given the urgency of our time and the emerging data on the efficacy of simply attuning to your heart. So I'd like everybody to just, for the next minute, place your awareness in your heart. You may want to put your hand over your heart and just contemplate, feel your heart in a spirit of gratitude and in a spirit of love. Thank you, everyone. Take a moment to connect your heart with the heart of everyone on this call. Everyone you know. In gratitude for life. And now I'll turn it over to good friend Jan Bonhoeffer, who's been on the sessions before. Thank you so much, Jan, for convening this session, and we welcome you and your colleagues.
Thank you, Jim. Thank you for providing a space that is so vital in our current time. Thank you for your perseverance of 90 days of providing this platform to all the different perspectives. And thank you for reminding everyone every day that coherence is what will help us to overcome the current confusions and turmoil. I believe Humanity Rising is one of the most important initiatives on our planet at the moment. It's part of this, if you like, silent revolution. And it tends to be the silent evolutions that make it to the finishing line, that survive all the turmoil and the samsaras. I would like to also thank Arjuna and Andrea to be with us today. So we're really part of the core team of heart-based medicine. And together, I guess I can speak for the three of us that we're grateful to be here today and to have 2 hours with everybody participating. This is an amazing opportunity for us, as we feel we come here as a student. And this to me is one of the amazing strengths of Ubiquity and Ubiverse, is that people meet as students to come together and learn from each other in conversation. Whilst the world that I was trained in as a medical doctor and on a classic academic career is very much one of the knowers. And the times, as you have outlined, Jim, are really the times for learners and less the times for knowers. So in the next 20 minutes, I'd like to share from a physician perspective, from a healthcare professional perspective, what we can learn and in what direction I believe we might want to look for change. And thereafter, Andrea will share the patient perspective. And thereafter, Arjuna will invite us to a practice that I guess we will hear more about. I will not label it right now, but we'll hear more about this. So we'll actually go into practicing what Jim has already pointed to. So in the first 20 minutes, I would like to make a few key points. And basically, I want to talk about COVID is real. That's our starting point, is why is humanity rising is because of COVID. So it's very clear that COVID is real. Anybody who says this is just an invention of some marketing company, it has not been where COVID actually hits patients and where it's a disaster. So it's a real disease, not the same for everybody. Everybody has their own subjective experience and their own subjective opinion, but it's definitely a real issue. Fear is a real issue. Jim has already pointed to it, and it's been alluded to so many times in all the many sessions of Humanity Rising, the importance of fear and how to deal with this. And in this session, we can look at how it affects healthcare professionals and patients and what we might want to do to overcome this or what change is required. So another point I'd like to make is that love is real. And we have started this session with a 1-minute heart meditation, a heart moment. As far as I'm concerned, this is the most important healing force we have on our planet. It is for free. Everybody has access to. But there are ways to learn to have access to this. And there are ways to facilitate access to this for those who have temporarily forgotten. And certainly in the medical profession, this is not recognized to the degree that it should be. Some people say that there's a lack of research and there's a lack of science. But I guess in this community here, joining this call and participating in that 1 minute, that's all the science we need. There's no more science needed to demonstrate that love is real. And there's no more science to demonstrate that love affects biology directly. Opening up to this feeling of coherence, or let me call it love, affects biology. It affects how our bodies work. We can feel it. Everybody knows this. So the only scientist we need is ourselves, really. Whether we want to be scientific about this and see, are there biomarkers of love? Are there things we can measure? And what happens if I open my heart to love and I'm with you? Does that change your biology too? And how might it do that? Well, again, we know that that is the case. So there's no point in arguing about this. And we can be fancy about it and do some research. And I hope we will in the future. As this is in the language of science and medicine, this is this being expressing its interest. This is this being expressed, giving attention to something that it perceives as real. So yes, we want to see science, but do we need it for change? Do we need it for transformation? No, I don't think we do. I would also like to talk about the fact that healthcare professionals can be healing. And we're ignoring this. At this point, the current paradigm is that healthcare professionals are brokers of knowledge and pills or surgery or some physical therapy. They have accumulated knowledge and experience, and that's all they have to offer, is to broker available treatments and develop treatments. I would like to take it a step further and believe that we can show that there's a role for healthcare professionals to be part of the treatment. Why part of the treatment? Because maybe that's the most important point to make, is that patients should be part of the treatment. And we have not really even started, I believe, to consider that. To some degree, psychiatry, psychology are absorbing this, but in general, let's say medicine, in mainstream conventional school medicine, I believe we're far away from the target. So there's a huge potential, and COVID is showing us all of the above points. So let me try and explain why and how. Why is love the fundamental primary healing force? Do I need to explain this? Don't we know this? Every friend that you talk to, every close relative that you talk to, if you ask them, how did you feel during your time of illness, during your time of dis-ease? What was it that really helped you? There's a unanimous answer. The unanimous answer is, the drugs and the surgery and whatever provided the conditions for a healing process. They provided the environment for the healing process. But what really helped me during that very dark night of almost feeling like I'm going to die, that was the hand of my aunt who was sitting on my bedside, or that was the hand of my child, or that was the lap of my mummy that I could rest my head on during that really dark time in my life. Those were the moments of connection, of resonance, of bonding, where the actual healing happened of a condition of which what the doctors call disease is really just a symptom. So what we're learning with COVID is yes, there is an infection. Yes, it's a viral disease. Yes, it has signs and symptoms. We can recognize them and we can see them. But we're also seeing all the collateral damage. We're also seeing what it does. So what is the gestalt of this disease? What does it actually elicit in people? What does it do to society? So it actually, it reveals a whole host of shortcomings and deficiencies and flaws in our society and in each and every one of us that we could regard as opportunities to learn and to grow and to evolve. So many colleagues from complementary medicine would probably say, we know this. We know that it's important to see the patient with a holistic perspective. And we know that it's important to heal. We know that it's important that the patient is taking responsibility and actually participates actively in a therapeutic alliance. Yes, that is true. And I believe there is not one medicine or the other medicine. And this is also something we learned from COVID. There's not one philosophy or the other, but we have to learn to work together. We have to learn to align and actually see what do the different perspectives provide for a more global and complete understanding of what is going on. And so one kind of medicine or the other kind of medicine to me is a moot discussion. So there's one healing process in patients, and there are different perspectives on those. And at Heart-Based Medicine, we feel that this is an opportunity to, if you like, let go of lobbying and societal discussions, but to actually focus on the common ground. And the common ground is love. That is the primary healing force. And that is what everybody knows is what we could look at so much more deeply and so much more closely. That's where we can learn and evolve most effectively together, every single one, regardless of school and trait and wisdom and ology and osophy. Let's leave this behind and see where is the commonality and how can we actually meet here. There are both sides. There's the coin, and on one side of the coin is the number. So there's the analytic part, the scientific part, and it's valuable. We've learned a lot and we're benefiting a lot, every one of us. And there's the other side, the head, and here they head more for the person rather than the mind. So both parts are important, which means if we really take this serious, this means that the healthcare professionals need to step up. First of all, the healthcare professionals by profession invite patients into a healing space. And to the best of my understanding, we're not equipped to do so, really, at this time. We are equipped to broker treatments, but we're not equipped to actually identify the place of health inside of us and to exhibit and exude the kind of health that we wish for our patients, that we exemplify this kind of health in the way we live, that we practice this kind of health supporting lifestyle as professionals. And so with authority and authenticity, we can actually invite the patient to step into this realm. I feel we're far away from this, and this is a part that is missing in our current understanding of medicine. I feel the patient experience would be a different log in quality if we were able to provide healthcare from this place. Yet, what does it mean? It means we need to look at ourselves. It means there is a transformational process required. I can tell you, I have not learned this at medical school. I have learned to grow up in a binary system that rewards performance and that applauds heroes who are working 150% and who sleep less and who are at the top of the rank. And that is what is promoted And it is not promoted that we actually take care of ourselves so that we are in a position to really provide a healing space that is credible for our patients. So here's where the patients come in. If we have this attitude, if we're ready to learn to face our inner fears, if we're ready to let go of our image of being this savior hero, this high achiever, high performer, if we are ready to let go of this and actually ready to serve the patient, we will be able to listen to the patient. We will be able to hear. And this is what is missing. And this is where we could do so much better in involving the patient and actually asking the patient, what is it that you need? That needs stability. And that stability isn't taught at medical schools. It needs deep roots. It needs the ability to welcome all these different walks of life, all these different experiences of pain and dis-ease every single day. And it needs the ability for us to actually stand there very strongly to be able to receive this and to resonate with love and to invite into the space of love. This is a different kind of training that I would love to see added to, having our physiology and anatomy and histology and all the good things down as well. But it's a part that is painfully missing. The part to help us sink into our hearts, drop deep, and from this place find stability, rather in a bloated bubble of sense of self that we call healthcare professionals. So maybe this is the time to hand over to Andrea and to invite Andrea Gardner to share with us the patient perspective and to see what is it, how can we provide more space and transfer responsibility for a shared healing process in a therapeutic alliance to patients. What is missing and where could we direct our attention to?
Thank you, Jan. Wonderful. The power of love. How can we argue with that? Yeah, well, thank you for inviting my perspective. I'm Andrea. I work with Jan on the communications team for heart-based medicine. And I'm not a doctor, though I have trained in very many complementary health modalities. But I'm here as a patient. I have been a patient, as I'm sure many of you have. And I'm just looking at the chat and noticing there's a real thread going here about, involving patients and bringing love to patients. And I'd really like to know if you could just, with a virtual show of hands in the chat, just let me know if you've ever been a patient in a hospital. I'm expecting this to explode. I'd be very interested to hear about your experiences and whether they've been positive or whether they've been negative. I'm going to be sharing one of my stories in just a little bit, but for the next 20 minutes or so, I'd like to look at medicine from a patient's perspective and explore what that current experience looks like for all of us and how it may evolve as we move beyond these COVID strange times into a new normal, if that's even possible. Wow, yeah, loads of stories coming in here. Somebody in for three times in the past year. Wow. Okay. Lots and lots of experiences as expected. Some positive and some negative. So Jan has very skillfully outlined what this is going to mean from a doctor's point of view and how to bring more love into practice. I'm really interested in whether a change of heart is needed within us as patients too. Whether we need to take a little bit more responsibility for our own health rather than handing over power and control to to the medical professional in front of us. I'm sure we don't all do that, but these are the times that we've been growing up in, if you like, have put medics on a pedestal. So it's very natural to expect some kind of outside or external solution to our problems. But that takes away our own intrinsic healing power, that power of love that Jan was referring to. So, as I said, I'll share a personal story with you in just a moment. But to make sure I'm not just speaking from my own experience, I did do a little bit of research into patient expectations and patient experience. And there was a peer-reviewed study which was published recently by the National Institutes of Health in the US, which was entitled, "What Can We Learn from Patient Dissatisfaction?" And as part of that study, 6 implicit expectations for quality hospital care were identified. So we'll talk a little bit about that, and by all means, just join in on the chat if you can. I'll try and read as well as speak, multitasking. So these 6 implicit expectations, rather than dissatisfaction and satisfaction, because that's a little bit vague. It's a little bit ambiguous. It's quite difficult to determine what is meant by patient satisfaction or patient dissatisfaction. It's much easier, I think, to understand if you put it in terms of patient experience, which is actually more in alignment with heart-based medicine's values. What are the patient experiences? What does it mean to go into a co-creative healing environment and to be honored for that, to be invited into that space? I'm not sure that we've collectively ever experienced it fully. I'm sure we've all had brief glimpses of that type of exchange. But to go into a healing situation and know that you're going to be fully supported in that is new ground, I think, for us. So let's have a little look at these expectations for quality hospital care. The first one is safety. Safety is, there's objective safety. So there were comments about breaches of safety, including misdiagnosis, medical malpractice, being administered with the wrong doses or the wrong medication, perhaps being discharged too early from hospital and then called back again and having to go through all the prep for that, and even a lack of hygiene, basic hygiene. So that's the objective safety measures that were mentioned. But equally important, I believe, is that subjective feeling of safety, which we all cleave to. If you're going into hospital or you're going into a medical environment, you want to feel safe, right? You want to know that you're in good hands and that you are, the outcome is going to be hopefully positive, or that it's certainly not going to get any worse. So that subjective feeling of safety comes usually from observed competence and confidence of the medical staff, that you're in their care and that they care. That's new. And also in the way that they communicate with their patients. How do they speak to you when you go into a hospital? What is your first experience when you walk in? All your senses are overloaded at that point. You're probably in a state of worry or even fear or panic. It's certainly not a comfortable experience usually. And you're not sure where to go or what's going to happen to you or where you're going to be, how you're going to be tested. All of these things, it's very important for whoever is caring for you to explain and to help you feel safe and to feel that you're going to be listened to. We all want to be listened to and seen. If you think about the qualities of love, being seen and being heard and being accepted without judgment are right up there at the top of that list when you talk about love. So why not have that in an environment that is specifically meant to care? There was a very well-known Canadian study that Jan reminded me of yesterday, where paramedics were trained to speak to their patients and drop down to eye level in the back of the ambulance and to make physical contact, just touch of the shoulder. And they're trained to say something like, hey, hi, my name's John, and I'm here to take care of you. And the next sentence is critical, because the next sentence is, okay, the worst is over, and we're going to get through this together. Isn't that transformational? So I am paraphrasing the training here, but the results were a very significant 30 to 40% increase in the rate of survival, just through that simple training in communication. So that's safety. The second part of this study looked at respect and dignity. And they're vital, you know, examples of where you might find this lacking in a hospital stay is lack of privacy, not being given that fundamental respect for who you are, rudeness by staff, by other patients, being talked down to. Perhaps you'll be more familiar with this in the US in an insurance system. If you don't have insurance, you may be talked down to or treated differently. Inappropriate requests is another one, just looking at my notes here. So, for example, one of my experiences was having been given the pre-med. I was then asked if I would give consent for an internal examination while I was under anesthetic. Wow. I really didn't feel, you know, I was brought up nicely. I was too polite to say no. I kind of wish I had, but at the time it just felt like, oh, okay, so this is part of the procedure. So really understanding, you know, that could be deemed as inappropriate. I'm not sure how you would tackle that in a medical situation, but I think some thought may need to be given to it. Feeling judged is another one. If you're not, you know, if you have a drug or an alcohol dependency, you don't want to be feeling that you're being judged by your doctor or your medical professional. You just want to be completely accepted for who you are, and given a pathway through. So that's respect and dignity. The third point within this study was prompt and efficient care. Now, I don't know if you've ever been to an emergency room and had to wait for hours and hours. Very frustrating when you see other people coming in and being treated first, and totally understandable in some cases, but not knowing is very disconcerting, particularly if you're in pain. And when we're in hospital, we tend to be feeling vulnerable and usually, you know, out of our usual routine. So we don't know what to expect. And we could be facing a life-changing operation or an uncertain outcome, at least. So some examples within the study were not being given water to drink, you know, and not even having those basic needs met. Elderly incontinent patients were incapacitated, having to wait ages for a bedpan. Anything, you know, that just erodes that dignity and keeps us waiting. And then there was a successful exchange of information was another outcome that was expected as part of quality patient care. So again, you know, lots of examples of mix-ups between staff and mix-ups between you know, charts being mixed up and the wrong information being given. Contradictions in advice between different carers, different doctors, different nurses, operations being delayed. There was one example of a patient who had to starve themselves all weekend because their operation was being delayed and delayed and delayed, and they were, you know, obviously nil by mouth, and so it was an entire weekend of no food, no drink. Being told what's going on, absolutely crucial, and yet it gets missed. It feels as though it gets missed way too often, that we just don't know what's happening next. You know, as a patient, you're completely in the power of whoever's taking care of you. You're in that environment where you can't necessarily speak up for yourself either. So there were two more within the study, and then I'll move into the the little story I want to tell you, but control over physical surroundings. If you've been in a hospital on a stay for any length of time, you obviously, you're in a room usually with lots of other people, which can be alien to most of us. And one of the fundamentals of healing is sleep. We all know this. There's so much research being conducted into sleep and its importance for our physical health and our mental health at the moment. And yet, it feels as though hospitals are designed to deprive us of sleep. There's very often lots of noise. There's lots of light and activity, and you're constantly interrupted throughout the night. So you're not really getting into that deep sleep that's necessary for healing. And then there's not being able to control that environment, and not simple things like televisions maybe don't work, or the food is not right for your diet or whatever. But they're sort of more minor inconveniences. So when you reflect on this wealth of information, it's very clear that a lot of it is out with our control as patients. But there are some things that we can influence. And I just looking at the chat, I can see here that, yeah, a lot of you have felt that you can influence your situation as a patient. So I just want to share a little story with you about a personal story that happened to me 5 years ago. I was scheduled for a myomectomy, which is a removal of a large fibroid, uterine fibroid. And I went for my pre-consultation. And I was blown away by my female consultant. She was amazing. She was practicing heart-based medicine before heart-based medicine existed. And she connected from the heart. I felt loved. I felt seen. I felt heard. And she really took the time to understand my worries and my concerns. And I'd come with this, I'd consulted Dr. Google and came in with a whole sheaf of notes, which probably really annoyed her. But at the time, I thought that was the right thing to do. And I'd done so much research that during the consultation, I'd got so curious about this procedure and was asking all these questions that I kind of got swept along by her medical explanations. And then I realized that she was talking to me like a colleague. And we both experienced this moment, simultaneous moment, when we remembered it was my body we were talking about here, not just some vague body over there, some objectified body. And that was interesting because we both kind of snapped back into reality. I must have gone a bit gray, realizing it was my body and I was going to have to go through this process. But she realized, that she needed to maybe change her communication style a little bit, and I needed to to stop asking so many questions probably. But for this particular operation, I had a very unusual request. I'd taken time to really prepare myself physically and mentally. I'm a clinical hypnotherapist, and so I'd asked the medical team to read aloud this affirmation, which I'd got pinned to my gown throughout the operation. And it read something like, "This operation is going smoothly and I'll make a fast recovery." It was all very positive. Even the anaesthetist played his part during this whole process and agreed to repeat that statement all the way through, even if the operation was not going smoothly. I didn't want to know. I just wanted to know that I was safe and I was okay. I was in good hands. It was going to work. I'm also a Reiki master, so I'd brought in a lot of Reiki and a lot of healing light into that experience. So I was very, very prepared, and I expected, I think, as a patient, to not be listened to be sort of brushed aside. But they were extremely accommodating, and the whole medical team got on board with this. So although, we had these affirmations going on and I was listening to this positive soundtrack, the operation didn't go smoothly at all. Actually, I ended up having a blood transfusion, losing 5 pints of blood. And it was pretty traumatic, I think, for the consultant who shared that with me afterwards. But but I felt no trauma. I felt absolutely no trauma afterwards because I'd subconsciously known that I was in safe hands. So I was I was recovering much quicker. I was back on the ward much quicker than the other patients. And there's a second part of this story, which is about recovery. I'm not going to go on for too much longer, but after 3 rounds of antibiotics to fight this stubborn infection, I was hooked up with drips and a catheter and a drain and all the usual paraphernalia that comes with recovery. And I remember asking the nurse on night duty what I needed to achieve before I could go home. And she said, well, your blood pressure's too low and your temperature's too high. So they need to be normalized before you can get rid of all this paraphernalia. And then you'll also need to be able to go to the bathroom on your own. So I said, right, okay, I'm up for a challenge. Give me 24 hours, I said. And she just, in a very Glaswegian way, she raised one eyebrow and she just said, "I write love," which in Scottish can be translated into, "You've got to be kidding. There's no way. It's not going to happen." So the next day she popped in to see me and she was very surprised that the whole nursing team was gathered around my bed and they were cheering. And every time my temperature dropped and my blood pressure climbed, I was given a kind of standing ovation. And eventually the whole ward was joining in. So sure enough, 24 hours later, I had my temperature was normal, blood pressure was normal, everything was taken away, and I was discharged the next day. So I guess I'm not saying that every patient should rely on positive visualization, because that's not the whole story. And that everything is going to work out well, because it certainly wasn't the experience I'd been hoping for. And that outcome could have actually been very different. You can't control the outcomes, but as a patient, you can control your intention, and you can set your intention beforehand and take some responsibility for that healing outcome. So although I couldn't choose the outcome, I could focus on what I could control. And to me, that was practice. But we can all learn that practice. I think the takeaways for me, when I shared this story with Jan, he was understandably cautious. He's been trained to diagnose and to take diagnostic pathways and to solve a set of problems. And he's also got lots more experience than I have of things not going quite as planned. But these are the takeaways for me. This is what made it a positive experience for me as a patient. I was prepared for any outcome, but chose to focus on what I could control. The medical team played their part. They listened without judgment and helped me co-create a healing environment. That to me is one of the fundamentals of heart-based medicine, that coherence and co-creation. And finally, I took responsibility for my body and its innate wisdom, but I also was reliant on their medical expertise and their knowledge to help me through. I didn't want to be treated as a set of problems to be solved. I'm sure you don't either. I wanted to be seen and treated like a whole person. I'm sure you do that too. So I think in conclusion, as a patient, when both parties bring their full selves to the table, healing can happen. So a knowledgeable doctor is fine, and an empowered patient is also fine. And we need to kind of learn to dance together. We need to bring that into the healing environment. So there's room for pattern recognition and intuition if we both take responsibility. And that's what drew me to heart-based medicine. So there's a question that I'd like to leave you with, is what support do you need to fully heal as a patient? And then just imagine if that was one of the questions you were asked during your consultation. I'll leave that with you for Arjuna to take over. Thank you.
There we are. Thank you so much, Andrea. And thank you. I think we've all been through our own version of the story you told and the stories you alluded to. So we're going to move into a practice phase now. We're going to move into something we can do together to shift our state or states collectively. So in a moment, we're going to actually close our eyes and do a practice. So maybe any final comments you have for the chat, do them now, because we're going to go inward in a moment. At the beginning of this presentation, Jan reminded us that COVID is actually real, and that's a good thing to be reminded of. And he also reminded us that fear is also real. You know, that we've got COVID to be concerned about. We've also got fear of COVID and fear of them and fear of what's going to happen. But there's another thing that's also very real that maybe is more prevalent in our world today and in the medical system than anything else. And it's the practice of not love. You know, you could talk about love as something we need to move into or practice or embody. You could also think about love simply as your natural state. Love is who you are when you're relaxed and when you're not in fear. So what is the opposite of love? The opposite of love is what we could call the act of othering, of making someone or a group of people into other than me. And when we do that, when we other people, which is something you have to put effort into to make somebody different than you, we shut down our natural ability, our natural tendency to love. And this is particularly prevalent in the medical world. Jan and I have a book coming out in about a month, which tells a lot of stories about the way that love has been slowly squeezed out of the medical world through othering. And the way that happens in the medical world is that the patient becomes a set of data. And the medical world has become increasingly specialized, which means that the person reading that data may have very little contact with the patient. So the patient becomes more and more objectified, something not close to me, not intimate to me, not like my family, but a set of data points. So you could say really that in the practice of medicine and the practice of life, our thinking process, the way that we think and the way that those thoughts coalesce into beliefs, into repeating thoughts, which are belief systems, the capacity, our tendency to think and believe creates othering, because we form ideological clusters, and those ideological clusters are different from other people's, and therefore they become different. And this has never been stronger, in my opinion, than it is today in the United States. There's almost, I mean, it's erupting into violence, and the violence is really perpetuated by differences in ideology. So you can see how othering is a very dangerous thing. The more we increase the tendency to other, the more we are willing to commit violence to another person. Initially, ideological violence, and then linguistic violence through language, and finally, physical violence. The heart, on the other hand, the heart is an organ that unites. You know, the heart is actually, the arms are an extension of the heart, right? The heart center, the energetic center in your body. The arms are an extension of it. And what do you do with your arms? You reach out and you hug people, and love is given and received through the arms. They're kind of tentacles of the heart. So the heart center is where we find unity. You know that if you're a woman and you've ever had a baby, you know that very well, that on day after 8 months and 20 something days, the baby was part of you. And then out comes the baby. And now here's this baby, which yesterday was in your body, and now you can hold. And there's a very strong feeling of oneness between a mother and a newborn baby. And anyone who witnesses a mother holding a newborn baby can see this feeling of no other, not othering. And that's really where we feel love. So we're going to drop into that together for a few minutes now. So I suggest we switch off the chat for a little while, maybe close the chat window so that we can close our eyes and drop in together. We're going to use a practice which is not new. It actually originates in Tibet, even before Tibetan Buddhism. So before Padmasambhava brought Buddhism to Tibet, this practice pre-existed in the Bon tradition. It's called Tonglen. towards the end of our practice together, I will put a link into the chat where you can have this at home if you'd like to use it. So please now just close your eyes and just notice. You don't have to change anything, just notice the way that the breath naturally fills the lungs and pushes down on the diaphragm a little bit, even moves the organs in the belly. Just notice the natural passage of the breath, the way the breath comes in naturally, and the way that the breath comes out with a little sigh when you breathe out. So just let yourself observe the natural movement of the breath. Breathing is happening all the time. If it stopped happening, there would be cause for concern. Breathing is happening naturally and easily all the time. And we're just going to direct that movement of breath for a moment to the middle of the chest, to this heart center, which is where we connect with love, where we connect with oneness, and where othering becomes less. So we're just going to direct the breath to the middle of the chest. You can do that. You can direct your breath to different places in your body. So we're going to direct the breath to the heart center. So we're going to use the breath almost like to fan the flames. If the heart center was like a little fire there, we're going to use the breath to fan the flames of the heart. Just use your breath to intensify the radiance of the heart, the alchemical power of the heart. And now we're going to do something very simple. We're just going to notice the way that thoughts are naturally passing within you. So just take a moment to notice the way that thought just occurs anyway on its own. And once you observe a thought passing, they tend to do it unprovoked, you're going to just use your breath to imagine the heart center is like a window. Think of it like a window, and everything that moves is outside the window. So thoughts are outside the window, the body is outside the window, everything that has movement and birth and death is outside the window, and love or consciousness is inside the window. It's just a way of seeing it. So you are pure consciousness inside the window, and everything that moves in time is outside the window. So you're going to take that thought, and just with the in-breath, you're going to breathe in now, and you're just going to absorb that thought home, just home into yourself, home into consciousness, home into awareness, home into love. So just welcome the thought home like a lost child. Come home, come home. Little lost thought wandering around in consciousness, just welcome the thought home. And then with the out breath, you're going to send a radiance from your natural state of being out through the window of the heart. Let's do that a few times. Just welcoming thought home with the in-breath. Just like lost children welcomed home through the window of the heart into love. And with the out-breath, sending a wave of blessing through the window of the heart into the realm in which thought dances. So let's do that a few times. Just it's like a visualization. You're welcoming thought home with the in-breath. Come home, children. Come home. Come home. Just come home. It's all good. You can come home now. And then you send a wave out, a wave of fresh creativity, a wave of fresh insight, a wave of fresh understanding. Do that a few more times. With the in-breath, welcome home. With the out-breath, a wave of fresh insight, fresh brilliance. Now, I'm going to ask you to notice whatever you are feeling emotionally. Just notice whatever emotion is there. You may access emotion through tension in the body. Just notice emotion. And if you can become aware of an emotion, just label it with one word, like fear or excitement, joy, anticipation. And now with the in-breath, you're going to welcome that emotion home through the window of the heart into love itself, into peace, into a love that does not change. And with the out breath, a wave of blessing. You can do that a few times. You notice emotion, welcome it home into love, sending a wave of blessing. With the in-breath, welcoming emotion home. With the out-breath, sending a wave of blessing. Do that a few times on your own. And finally, I'm going to ask you just to scan your body and notice anywhere in your body where the attention is calling. It could be some tension, some sensation, anywhere that your body is asking for attention. Just notice that. And then with the in-breath, welcome physical sensation home through the window of the heart into formlessness, into unborn awareness. And then with the out breath, recreating the body out of nothing. Quantum physicists tell us that's what's happening all the time anyway. So with the in-breath, it's returning form home into formlessness, into the unified field. With the out-breath, a fresh incarnation. Let's do that a few times. Welcoming form home into formlessness. With the out-breath, form reborn into physicality. Now you can just practice this with a few breaths on your own, whether it's thought or feeling or sensation, doesn't matter. Just welcome anything you notice, whether it's a thought or a feeling or a sensation. Just welcome it home through the window of the heart. With the out breath, sending a wave of blessing. Do a few more breaths with the in-breath, welcoming whatever moves in time. Welcome it home through the window of the heart into unborn awareness, into peace. And with the out-breath, a fresh wave of incarnation. Now we're just going to expand the circumference of this absorbing and blessing a little bit. And you're just going to remember someone close to you. If there's someone in the same room right now, you could do this with whoever's in the same room. Otherwise, just think of someone close to you, someone you feel close to, connected with. It could be your child, your spouse, your partner, it could be whoever. And now you're going to continue to welcome your own thoughts, but also the thoughts of this other person. Doesn't really matter, it's all thoughts. It doesn't matter who we think they belong to. Just now welcome your own thoughts and the thoughts of the other home through the window of the heart into silence, into stillness, and then another wave of brilliance, another wave of fresh thought, fresh creativity, thoughts that have never been thought before. Let's do that a few times. Welcoming thought, but not just my thought, but the thought of the other as well. With the out breath, wave of blessing. Do that a few times. All thought welcome at home, no matter who we thought it belonged to. All thought welcomed home. With the out breath, wave of blessing. Now we'll do the same with emotion. Whatever emotion or feeling you notice in yourself, but we're going to expand just to include the feelings of the person you feel close to. So welcoming your feeling home and their feeling home too. All of it welcomed home into love. And then with a blessing, wave of blessing. With an in-breath, welcomed home into love. With the out-breath, love sending a wave of blessing. With the in-breath absorbing. With the out-breath, wave of blessing. Absorbing the feelings I have called my own, absorbing the feelings I have called the other. Everything welcomed home into love. Wave of blessing. And finally, physical sensation. Welcoming the physical sensations I have called my body, and also the physical sensations of this other, all welcomed home into formlessness, into unborn awareness, and then fresh wave of incarnation. Do that a few more times. Thoughts, feelings, sensations, whether I've thought they were mine or belonging to this other, welcomed home, fresh wave of blessing. And now we're going to expand it a little more. There's a group of friends on this call. We all feel connected. We're all connected in Humanity Rising. We're all friends of Jim's and friends of Richard's and now friends of Jan and Andrea and Arjuna. So all of these friends together on this call, we're going to practice this for everybody on the call, okay? So we're going to just now take an in-breath. You're going to welcome your own thoughts home, but all the thoughts of everybody on the call is going to be welcomed home into stillness, into consciousness prior to thought. And now, sending a wave of brilliance, a wave of fresh creativity into all the bodies on the call. Let's do that again. All the thoughts welcomed home into stillness. All the minds recreated, fresh and new. Let's do that again. Everything absorbed home into stillness. Everything reborn. Let's do it again. Everything absorbed home. Everything recreated. Now we'll do the same with feeling. Absorbing my feelings, but the feelings and emotions of everybody on the call. You can do that. All the feelings welcomed home into love that knows no other. And then love blessing all of the emotional bodies on the call. Once again, all the emotions welcomed home into love. Wave of blessing. Maybe you start to get the hang of this now, that you are the returning point of everything. And you are the originating point of everything. Welcoming all the feeling home. Just like children welcomed home at the end of the day. Come home, you open the door, all the children welcomed home, all of them. And then all the children sent out to play. Let's do that now for all the physical sensations of everybody. First your own, and then all the physical sensations on the call, all over the world. Home into unborn awareness, unified field. And then all the bodies on the call blessed with new energy. Again, all the physical sensations welcomed home. All the physical sensations blessed. Now let's do that without differentiating. So Your own thoughts, your own feelings, your own body sensations welcomed home on the in-breath, and everybody on the call, everything that moves, everything that constitutes individuality, all of that welcomed home on the in-breath, into unified field, everything reborn on the out-breath. Let's do that a few times. That's very good. Do it a few more times on your own. Now we're going to expand it a little more, and you're going to remember somebody or a group of people who you have in the past disagreed with. It might be an ideological group who you feel very much opposed to. In America, that's quite easy. But if there's some political or religious or whatever group that you really have not sympathized with, you're going to put that into the field now. So as you absorb, you're going to absorb your own thoughts and all the thoughts of the people on the call and all of the thoughts of the group you have thought of as other. Everything welcomed home. All welcomed home, all the children, the children who come home all clean and tidy, and all the kind of children with scuffed knees who've been playing a bit rough. All the children welcomed home. All the familiar thoughts and the unfamiliar thoughts, everything welcomed home. Fresh wave of blessing. So we're going to include things that we thought were other now. Absorbing thought, the thoughts that are familiar, the thoughts that are unfamiliar, everything welcomed home. Everything recreated with fresh creativity. And now the emotions that you are friendly with and familiar with, but also the emotions that you thought were really belonging to other people. Oh, I don't have those emotions. All of the emotions welcomed home. All the pretty ones and the not so pretty ones, everything welcomed home. And a fresh wave of love. All of the emotions come home. No discrimination. Everything. Come. Everybody, open the doors wide. All the children welcomed home. All the children sent out to play. Once again, all of the emotions welcomed home into love. All the emotions sent out to play. Let's do that a few times. And finally, we do it with physical sensation. My physical sensations, the physical sensations of the people on the call, and the physical sensations of the people we felt most separate from. All of that welcomed home. All the bodies come home into the unified field. And then all the bodies reincarnated out of nothing. All the bodies welcomed home. All the bodies reincarnated. And we'll do one last wave now. You can, now that you realize just how vast you are, we're going to take all sentient beings, okay? All the thoughts of all sentient beings, so all the thoughts that are active on the planet right now, every thought on the planet, all welcomed home, so the entire mental field disappears globally. All gone, all reinvented out of nothing with fresh creativity. Once again, the entire global mental field absorbed home like a vast vacuum cleaner and then reinvented out of nothing. Let's do that a few times. Global mind brought home into stillness, the world recreated. Let's do that for the global emotional body. All of the emotions that are being felt anywhere on the planet brought home into love. The entire collective field of emotion recreated out of love. All brought home. All recreated. And finally, all the physical sensations, all of the bodies of all sentient beings, brought home into the unified field. All incarnation welcomed home. All incarnation recreated. That's very nice. And just to round it off, we're going to just come back to what we call me. Just check your own physicality now. And just to make sure nothing got anywhere lodged anywhere, we did this so big, we'll just come back to your thoughts. Welcome any thought home into stillness. Bless your own mental activity. Your own thoughts welcomed home. Your own emotions welcomed home. And now your own physicality welcomed home. You can stretch your hands up above your head. Stretch side to side. And let your eyes float open so you can see the screen again. Well, congratulations, everybody. That was Tonglen, which pre-existed Tibetan Buddhism. I'm going to just now paste for you into the chat the recording of that, which is a little longer. We just did a shorter version. There it is. So in the chat, you'll see a recording. So if you found that useful for any reason, it's yours. It's a 30-minute version. You can do that every day if you like. I wanted to share with you that in the field of medicine, particularly, this has proven to be extraordinarily effective. I've been teaching this method as part of the work I've been doing for about 25, 30 years. And about 20-something years ago, a woman came. Her name was Connie Kishbo. And she, at that time, she was the senior research nurse at UC Davis Medical Center, which is about the most stressful job you can imagine, because she was coordinating between the patients and the doctors at UC Davis Medical Center at the Oncology Research Center. It's very stressful because they only do research, oncology research, with younger people who are really, if somebody has cancer and they're in their 70s, they don't give experimental drugs. But if this is somebody like 30s or 40s, they have cancer, none of the conventional treatments have worked, so they use experimental drugs where there's a very, very small chance of it working. So Connie Kishbo's job was to be a coordinator between the patients and the doctors. Super stressful job. Everybody was putting pressure on her. She was at her wit's end. She had a beeper that was on 24/7. It was back in the time of beepers. And she came and did a training with me in 1998. And she learned this method, we call it the heart meditation. And she took it back to her work. And there's in a moment, I'll paste into the chat, I'll paste her story. It completely, utterly transformed her work as a nurse in the oncology, more than anything, more than any training she had. Just the capacity to absorb and to bless silently. She stopped experiencing her patients and the doctors as other. Just naturally, she started to experience a sense of oneness. So she could still, of course, recognize that they appear different, but she could feel the underlying oneness. She said it was the most powerful intervention or most powerful training that affected her work as a nurse. And it's this kind of direction that we, not just through this method, but it's this kind of direction that we are working towards in heart-based medicine, is to, of course, to benefit from all of the technology that's been developed in medicine and all of the data that's collection methods. Somebody's saying there's an error message. I'll fix that in a moment. Just when I finish speaking, I'll fix the error message. I'm not sure why you're getting that, but I'll fix it in just a sec. Yeah, we don't want to get rid of all the advances in medicine. There's been incredible advances in how to heal disease, but we also want to revive this capacity, which is natural to ancient healing traditions, to shamanism and to traditional Oriental medicine and so on, for the healer to know how to create this resonant field of healing. So I'm going to hand back to, I'm not sure who, I'm not sure if it's Jan or Jim, but I'm going to hand back, and while I'm handing back, I'll go ahead and fix that link that people were having trouble with.
Thank you. Thanks a lot, Arjuna. Thanks a lot, Andrea. And thank you for everybody sharing such a rich discussion in the chat. And I realize that several threads have already started to evolve and possibly want to evolve further. And we are working with Jim on the possibility to create a forum, let's say a healthcare forum, a space on Ubiverse where we can kind of structurally pursue these conversations and share our experiences and share practices such as the one that we've just experienced with Arjuna. I've put also a link in the chat to guide you to the webpage where we're starting to build a care lab and a skills lab. So the care lab is about a collection of skills, a collection of practices that help us to improve our self-care and to actually create that healing space and that healing capacity and the deep roots that allow us to actually do this work. And there's the skills lab, which I feel is really the part that is needed to increase our professionalism. So this is not about being woo-woo and unscientific, but this is actually the part that helps us to be more professional than we can currently be as we are trained when we come out of medical school. So there's a link where you can explore this and see what is happening. If you wish to, if you like some of those things, we like to hear the feedback. And because this is kind of just evolving as a repository, if you feel you wish to contribute to this, contact us through the webpage. So there's ample opportunity to share and exchange and suggest and co-create. And this is really what heart-based medicine is about. We're here as students to learn from each other. And so your comments and your inspirations are very much welcome. You will also see that there is a link not only to blogs and podcasts, but there's also a link to a Facebook group that we're building up now and where we're really wanting to start these conversations. So right now, the social media, we have kind of used this so far kind of for information, but we would really like to use it for conversation and kind of change into this direction. So there is this private Facebook group that we're building, and we try and see that we have this conversation there. The best way to contact us is through the website. There's a contact form, and there's an email also. So that's really a very good way to do this. This is the email, and you can also just complete the form if you wish. So those are possibilities for us to continue beyond this, beyond the time that we're given. And so let me ask anyone here if there's a particular item that you would like to discuss or see discussed in more detail during the time that we have together. And I will ask Jim to what degree we can expand the conversation here.
Sure. Let's take another few minutes if anybody has any particular issues. One question is, do you use EFT, emotional fitness training?
That's a question we get a lot with a different, if you like, with different content, whether it's EFT or other techniques or technologies. The question is, who is we? So do you use? Heart-based medicine is not a an ology or a fixed training set. It's an open platform. So Diane, if you're asking, do we use EFT? Well, let me change this around and say, what is it that you appreciate about this? How does it serve you? And how do you see it serve healthcare professionals and or patients to improve the therapeutic alliance and really see that we're entering a co-responsible training?
Another question, Jan, is around fibromyalgia. And how do you deal with fibromyalgia?
Okay, another big question. So we can replace this term, which doesn't mean very much. It means a lot for those who have the experience, but it sounds more technical and knowledgeable than it seems. Very little is understood about the experience of pain in muscles, along the skeletal, along the trigger points. There's a gazillion of reasons for this. To me, fibromyalgia is one of the symptoms of probably what is the right word? Not the condition, but a disposition, a place where we are in life that is showing up in this form. And so to me, one of the key questions is not so much to look at what is the cause of this? Can we find a virus? Can we do so? This is something that traditional medicine does, and this is interesting from a heart-based medicine point of view. A key question to me is, what does my experience that I'm having right now, what does this do to me? How does it affect my life? What do these effects do with me? What opportunities do I have to look and see, regardless of what the physicians call it or whatever label is given to it? There's a huge difference between the subjective experience of something that is objectively called fibromyalgia or something else by physicians. I'd love us in this forum to give our attention to the subjective experience and the journey to the inside, rather than focusing on the objective classification and the journey to the outside world of thought that we've just explored with Arjuna.
Maybe a final question, Jan, the utility of heart-based medicine with those who are mentally ill.
That's a huge topic and really important. Yesterday, during a Facebook Live on the Heart-Based Medicine Facebook page, I tried to address that. There are different elements to this. One is the healthcare professional perspective. So how do we deal with mental illness of healthcare professionals and the stigmatization around this? You know, how do we deal with burnout, with suicide, with every fourth healthcare professional being actually out of order and out of balance? That's a huge question. How do we invite this, and how do we change paradigm? Thinking about what do we learn from COVID? How do we change paradigm that having burnout or feelings of depression, frustration, feeling down to the point of having suicidal thoughts, is this a sign of weakness as it is classified in the current paradigm? Or can we address this much, much earlier, for example, at the first day of medical training, and to see what are actually the basic skills required that we can teach to healthcare professionals in order to build that capacity, in order to build this kind of resilience that is based on love rather than on perseverance through stress.
Good. Well, thank you. Thank you, Jan. And this was a splendid session. Thank you for your leadership in developing heart-based medicine. Andrea, thank you for your perspective from the patient. It's not often emphasized. We always focus on the doctor, most of whom, as Jan just pointed out, are stressed out, close to burnout, and need heart-based medicine as much as the patients do. And so that was a very good balance. And Arjuna, thank you for your meditation. You could see in the chats, people were very profoundly moved by what you offered. So thank you for that. One of the queries was around medicine and sound. And that's a whole topic sometime, is the utility of just sound on the body that we might contemplate. And we're going to continue doing our daily heart coherence meditations. Jan, would love to have you back maybe in the new year after you've kind of sorted things out and you've got everything up and ready to go. We want to continue to support heart-based medicine in any way that we can. One of the tyrannies, I would say, in the world today is the domination of thinking by reductionist science that believes that we're in a random materialist world without purpose, that the humans are just aggregations of chemicals without meaning. And we're doing sessions in Humanity Rising on the emerging physics, the emerging cosmology that is demonstrating incontrovertibly that the universe is alive, intelligent, intentional, and that we're in one big information feedback loop that knows about us, that we're feeding into. So bringing that mentality of aliveness, interconnectedness into medicine based around the heart could not be more timely, more important, in fact, critical to human well-being. We've got to move way beyond the notion that you solve a pandemic with a vaccine.
Yeah.
Maybe one of the most limited perspectives, but you can see how it completely dominates the political, scientific discussion. But it's only one little sliver of real healing. So the revolution in science, at a time when the scientists are the priesthood, is the kind of reformational energy that we need. And you and Arjuna and Andrea are helping to lead that charge. So you are on the front lines of revolutionary change. So thank you for that. And tomorrow we're going to continue our scientific discussion by welcoming a panel that's being convened by Jeff Ganuk. It's all about a new theory of evolution that is not based on the Darwinian notion of the survival of the fittest, but is based on the emerging understanding that the real momentum and driver of evolution is cooperation, within the context of which there is certainly competition. But even in competition, the evolutionary data shows that people cooperate to compete. And so we're going to have a very interesting discussion, and we wanted to juxtapose the revolutionary foment in medicine with the revolutionary foment in evolution theory. And in just a few weeks' time, we're going to have a panel on the new cosmology. The reason why this is important, just in closing, is perhaps the most important thing humanity can do at this juncture for our survival and for our healing is create a new story. And the story of Darwinism and the story of reductionist science, just like the story that the physician knows all, and Andrea, you just need to lie down and behave yourself and stay silent, is the story that we have to repeat, we have to expel, transcend, and include. And what you were really doing, Andrea, you were creating your own storyline for your procedure. It was beautiful. You told the doctors the story you wanted to be told as you were under anesthesia and under their control. And it was your capacity to change the story that contributed to your healing. And many people on the Humanity Rising sessions have said it's critical that we tell a new story. And the story has to be told in every domain of human activity. And I think it's in the end, it's the same story. We're creatures of the earth. The earth is a living organism. Everything that we are, we received from Mother Earth. She's alive. She's intentional. She's compassionate. She's communicating to us. And she wants us to succeed. And she produced us for a reason. We're here for a reason. And that's what Humanity Rising wants to contribute to, is to work with all the people like Jan and Andrea and Arjuna in heart-based medicine and pro-social evolutionary theory and beyond, to create a new story that can empower all to move the world into a better place after the pandemic than we found ourselves at the beginning. So thank you, everyone. We'll see everybody same time, same station, 5 o'clock to 6:30 p.m. Central European time tomorrow on this Zoom line and live stream with our partners. Thank you. Goodbye. See you tomorrow.
Thanks a lot.
Thank you.
Well done, you guys.